Hi, this is Jonathan Gaspar, and I'm the Clinical Director of DNR Staffing. Today is June 13, 2017. Advocate Home Care, one of our large home health agencies, recently just implemented Therapy Practice Optimization Program for Medicare patients. Advocate created rehab visit guidelines in which they added range of approved visits per diagnosis type and a process for oversight and management of therapy care. Therapy care oversight means that there will be a dedicated therapist from Advocate who will be reviewing our plans of care and make sure that visits recommended mirror the therapy need of the patient. All evaluations starting this week should follow Advocate Rehab Visit guidelines. Their guidelines are using evidence-based industry standards along with clinician assessment and documentation of patient care plans. What this basically means is that based on patient diagnosis, a number of visits has been determined to be the anticipated number needed. An example of this is a patient with Parkinson's disease who had recent hospitalization due to the exacerbation of the condition. This type of patient will have 5 PT and 3 OT anticipated visits according to the rehab visit guidelines. This number of visits will be automatically approved by Advocate. You can also do less visits if it is appropriate. However, if the case will require more than this number of visits, you have to get further authorization from Advocate to extend the visits. You need to call Advocate's office 72 hours prior to the last authorized visit. TNR will notify you if the extension is approved. Any extension of visits made without approval will not be paid by Advocate. Take note, though, that visit frequency on the initial evaluation should reflect your recommendation, if it is not the same as that of the rehab visit guidelines. To avoid unauthorized extension of visits, TNR will notify you of the anticipated number of visits through Therapy Boss. Once TNR receives the evaluation, TNR would schedule the visits and have you follow the schedule. You can move the visits around in the Medicare week, but you need to make sure that the last authorized visit is a discharge. The scheduled discharge should be the reminder to call Advocate and request the visits if you need them. Should Advocate approve more visits, TNR will change the discharge to a regular visit and schedule the newly authorized visits. This change reminds us of a very important aspect of therapy, and that is performing and documenting skilled services is the key to getting your plan of care approved or to getting more visits. Not only your documentation should reflect the need of the patient for therapy, but it should also show the skills that you're going to bring to the visits that the patient or caregiver cannot do without you. Saying on your note that you perform gait training with a patient for 50 feet with walker or providing strengthening exercises to both upper extremities is not enough to justify a visit or more visits. You have to explain why the patient needs to do those and for what reason and for what function and why do you need to be there during the intervention. I will send out an email to everyone in the next day or two to explain further this Advocate program. Thank you very much.